My name's Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. Before that, I was a fly fishing guide in Patagonia, Chile, and southwestern Alaska for a decade. This is part 3 of our vagus nerve stimulation to improve pelvic health series. This is from our online dry needling 2 class. It's a 10 CEU, fully online class. Check it out at intricateartseminars.com. One of the reasons that I like this study is they specifically talk about the imbalance in the autonomic nervous system. So you're starting to see some more studies look at stuff this way because it's actually the way to fix it. It's just that our system doesn't like stuff being actually fixed. So it's hard to get this stuff published a lot of the time. But this one did a pretty good job. So one of the primary things I talk about in women with PCOS is they always see the same thing with the nervous system. Elevated sympathetics, depressed parasympathetics. This is exactly why vagus nerve stimulation is so helpful for this stuff, you guys, because it's the strongest way to reverse the problem of the nervous system, right? So they're also looking, so basically what this study talked about the nervous system dysregulation as a comorbidity for PCOS, you guys. And it's not, I guess you could consider it that way, but it's the cause of PCOS, right? So this paper was looking at vagus nerve stimulation and what it did for people with PCOS symptoms including obesity, insulin resistance, type 2 diabetes, inflammation, microbiome dysregulation, cardiovascular disease, and depression, all of which are also commonly present in PCOS patients. So you guys, this is not confusing or complicated at all. Chronic sympathetic hyperactivity can cause 100% of all those symptoms, including cardiovascular disease, which is the underlying thing that causes cardiovascular disease also. Some people, it's going to cause PCOS. Some people, it's going to cause depression. Some people, it's going to cause heart palpitation and cardiovascular problems. Some people, it will cause all this stuff together, unfortunately. So that's why a lot of the time in this paper, and they're saying that you see people with PCOS also have all these other problems. Not surprising whatsoever, right? So this paper proposed a model focusing on regulating energy metabolism, right? Which is 100% what we're doing. If the mitochondria are hypoxic, which they are when the sympathetics are hyperactive because everything is constricted and hypoxic, by elevating the parasympathetic nervous system, we're going to vasodilate everything in the body. We're going to improve blood flow to everything. We're going to give the mitochondria more oxygen, which is going to allow the mitochondria to produce 18 times more ATP per molecule of glucose. Remember, you guys, in anaerobic respiration, one mitochondria per molecule of glucose more or less produces like 2 ATPs. With enough oxygen, that same mitochondria with just one molecule of glucose produces somewhere around 36 ATPs. That's about an 18-fold increase in the amount of energy each mitochondria produces just by changing the level of oxygen to the muscles, which is what one of the things that dry needling does the best, and it's one of the chronic problems with all this stuff. So this paper does a good job at talking about why they think the needling is helping, right? So that was number 1. Number 2, reversing insulin resistance via its anti-diabetic effects. So that could be the same underlying reason, you guys, that it improves energy metabolism is why it improves diabetic symptoms. Our mitochondria are one of the primary processors of glucose, the primary processor and store of glucose in our body. If our mitochondria don't Our skeletal muscles and the mitochondria in those skeletal muscles, if they don't have oxygen, they can't process and store glucose normally. We end up with more free-floating glucose in our blood. And remember, the difference between a regular person and a full-blown type 2 diabetic is only about 1 teaspoon of sugar in the blood, you guys. A healthy person has around 1 teaspoon of free-floating glucose in the blood. And a full-blown type 2 diabetic only has about 2 teaspoons. So that's just a 1 teaspoon difference, go from diabetic to non-diabetic. And the biggest thing that we can do is increase the mitochondria's ability to process glucose and add more mitochondria onto the body, which is done through exercising and building more skeletal muscle mass. So very, very good paper looking at this. Number 3, activating anti-inflammatory pathways. So remember, the strongest anti-inflammatory pathway in the body is the NRF2 pathway. It's the strongest one that we know about right now. It's a mitochondrial anti-inflammatory pathway. We know the vagus nerve stimulation turns on the anti-inflammatory pathway and also reduces pro-inflammatory markers. So we're tackling inflammation from both sides. Super, super awesome at activating anti-inflammatory pathways. Number 4, so remember you guys, these are the proposed methods by which vagus nerve stimulation is working. I agree with all these, and this has all been shown to be true. Number 4, restoring homeostasis of the microbiota in the gut via the gut-brain axis, right? So the vagus nerve is the connecting highway of the gut-brain axis. The vagus nerve connects the gut and the brain to each other. Also, the sympathetic chain does. So remember, you guys, I talk about the vagus nerve. Just remember that the sympathetic chain that goes down the anterior lateral portion of the vertebrae is the opposing part of the nervous system to the vagus nerve. That's how it should be thought about. Number 5, restoring the sympathetic vagal balance to improve cardiovascular outcomes, cardiovascular disease outcomes, right? So we know this is also true, you guys. One of the most common things that people say when they come in with, if they have heart problems after they get vagus nerve stimulation, is they'll be like, man, could that have like made my PVCs or my arrhythmias better? And the 100% the answer is correct. It's one of the reasons that they say good results from like injecting lidocaine around the stellate ganglion around the first rib, you guys, because that's a sympathetic autonomic control center for our heart. If you have sympathetic hyperactivity, the stellate ganglion gets abnormal bursts going to the heart. It gives you abnormal heart rhythm. So vagus nerve stimulation, super good thing to help heart rate. And number 6, in modulating mental disorders, vagus nerve stimulation should be a mainstream treatment for all mental health problems. It's one of the best things to improve people's mental health. I improve people's mental health all the time, you guys. And I am not doing psychotherapy with people. I'm just regulating their nervous system, and their mental health gets better on its own. It's really, really cool. So here's a chart from that paper. I put the little blurb in the chart down there, you guys, so you can follow it. It's a little bit blurry. That's how it was in the paper, and I could not find a clearer version. I tried to sharpen it a little bit for you guys, so sorry about the little blurriness there. But this is a good diagram. So talking about ear vagus nerve stimulation, right? Vagal activation, you're getting energy, you're getting positive effects on energy metabolism. You're getting an anti-diabetic effect, which is awesome, which improves insulin sensitivity, right? You're getting anti-inflammation. You're improving the microbiota in the gut-brain axis. You're improving cardiovascular function by improving the nervous system. So again, you guys, that's why dry needling in general, especially if you use it in the way that I think is the most powerful, to use it by specifically targeting the autonomic nervous system. The reason that dry needling and acupuncture work at a very base level is they make the autonomic nervous system more homeostatic because they have an effect of depressing the sympathetics and elevating the parasympathetics. That is the direction that we need to push human beings' body to achieve a more homeostatic autonomic nervous system. If that fundamental fact was flipped around differently and needling just had the general effect of causing an overall elevation of sympathetic tone, nobody would needle because it would make you worse. So if the fundamental underlying reason that needling works is because it pushes the nervous system in the direction that we need to go to be more homeostatic, which is elevating parasympathetics and depressing sympathetics, if you can compound that or amplify that effect by specifically trying to do that more, you can get such crazy outcomes. And that's one of the things that happens when you treat the vagus nerve in the ear along with all the other treatments that you're doing, you guys. It just makes everything better, right? So mental modulation, modulate key brain regions, hippocampal neurogenesis, again, gut-brain axis, decreases inflammation. Super, super helpful for all this stuff, you guys, which is all helpful for PCOS. So this is a pretty good diagram. Here's another diagram from that same paper, you guys, possible pathways and mechanisms of action. This is more or less just what we looked at just in the written form. So again, they talk about regulation of energy metabolism via bidirectional vagal signaling, reversing anti-diabetic effects, improving diabetic effects, right? So improving insulin sensitivity, improving glucose processing. They're restoring homeostasis of the gut microbiome and the gut-brain axis, restoring vagosympathetic balance for heart stuff, improving mental disorders, and they talk about some of the different things through which they're seeing these happen. And I can just confirm that all these things are true just from actually seeing patient outcomes for quite a while now, you guys. So really awesome stuff. Okay, here's a different diagram. I included this one because I like to give people kind of like a mental model of what's going on. So this is a good kind of simpler diagram, and I included the blurb on the left, you guys. I'm not going to go through like what all the stuff is, but this is a good thing because we've been talking about the vagus nerve. So you can see the vagus nerve on the upper left part of this picture, right? So that would be more or less the parasympathetic portion, one of the parasympathetic portions of the autonomic nervous system. The other parasympathetic portion would be also down on the left, the pelvic nerves, right? And then the sympathetic stuff is going to be on the right, and that's the sympathetic chain. So it's the parasympathetic portions and the sympathetic chain are it's all one continuous thing, you guys. The sympathetic part is like in the middle, and the parasympathetic parts are on the end, on the top and the bottom. That's a good kind of overall diagram. You guys can look at that. Again, there's a reference in there for where I got that from if you guys want to look at that whole paper. That actually is a pretty good paper. It has a whole bunch of good anatomy stuff in there, you guys, so I would probably recommend looking at that. That's all these papers. The full version of the paper is included, you guys, so you don't have to go looking for them. Thanks for watching part 3 of vagus nerve stimulation to improve pelvic health. Keep an eye out for part 4 on my YouTube channel. I'll be making consistent videos about this stuff, including other stuff related to dry needling, nutrition, spinal manipulation, and other stuff like that. Check out our website at intricateartseminars.com for big discounts on all of our courses, including our online and in-person courses. Check out school.com/CEU, SKOOL.com/CEU. Thanks, you guys. I hope you enjoyed. Keep an eye out on our channel.